The hypnic jerk. You know that moment when you are about to fall asleep and suddenly your body jumps? It feels like you are falling from a cliff and then boom, you wake up. That strange feeling has a name, the hypnic jerk. It is one of the most common sleep problems. It feels like your body suddenly cancels sleep mode. Scientists believe your brain gets confused. When your muscles relax, your brain thinks you are actually falling, so it quickly sends emergency signals to your body to catch yourself. It is like your nervous system does not know if you are awake or asleep. Some researchers think this comes from ancient times, maybe a reflex to stop us from falling out of trees while sleeping. Stress, caffeine, and lack of sleep can make it happen more often. Sleep paralysis. Sleep paralysis is like a nightmare in real life. Your brain wakes up, but your body does not move. You are fully awake but completely frozen, like someone paused your body. This happens when you are leaving REM sleep. During REM sleep, your body is naturally locked so you do not act out your dreams. If your mind wakes up before your body unlocks, you feel trapped. Many people feel fear, heavy pressure on their chest, and sometimes even see or hear things that are not real. In the past, people thought demons or aliens caused this, but really it is just your brain waking up before your body. And here is the scary part. The more you worry about it happening again, the more likely it is to return. Fragmented sleep. Have you ever woken up many times in one night? That could be fragmented sleep. Your body rests, but your sleep keeps breaking. You never reach deep, healing sleep. It is like charging your phone with a broken cable. It connects, disconnects, and never fully charges. Causes include anxiety, noise, pain, sleep apnea, or alcohol. You may think you slept 8 hours, but your brain knows it was poor quality sleep. Over time, you feel tired, moody, forgetful, and your immune system becomes weak. You are not just losing sleep, you are losing good sleep. Exploding head syndrome. It sounds scary, but your head does not actually explode. Just before falling asleep or waking up, some people hear a loud sound, like a bomb, gunshot, or crash, inside their head. No one else hears it. It does not cause pain, but it feels very frightening. Researchers believe it happens when the brain's sound system misfires while shutting down for sleep. Many people think they are having a stroke the first time it happens. But it is harmless. It is like your body says goodnight, but your brain shouts, "Surprise!" Hypersomnia. Hypersomnia is when you sleep a lot but still feel exhausted. People with this can sleep 10, 12, even 14 hours and still feel tired. It is not laziness. It feels like your brain refuses to fully wake up. It can be caused by brain conditions, medicines, or other sleep problems like sleep apnea. Even daytime naps do not help. No matter how much sleep you get, your brain still feels empty. The world may call you lazy. Your body feels broken. Sleep onset insomnia. This is when you are tired, but the moment your head touches the pillow, your brain becomes active. Your thoughts race. The more you try to sleep, the harder it becomes. This usually happens because your nervous system is too alert. The stress hormone cortisol stays high, making your body feel awake. You get anxious because you cannot sleep, which makes it even harder to sleep. Suddenly it is 3 a.m., and you are searching how to fall asleep fast. Nocturnal leg cramps. These are painful muscle cramps in your legs at night. They often happen when you are falling asleep or in deep sleep. You wake up suddenly with strong pain in your calf. They can be caused by dehydration, nerve pressure, or low minerals in the body. Even after the pain stops, you may stay awake for hours. Some people fear sleeping because they expect the pain again. Sleepwalking is when your body moves while your brain is still asleep. You may get out of bed, walk around, move things, or even leave the house. It usually happens during deep non-REM sleep. Your movement system turns on, but your awareness stays off. Most sleepwalkers do not remember anything the next day. It is like your body is on autopilot without a driver. Bruxism, teeth grinding. Bruxism is grinding or clenching your teeth while sleeping. You may not know it is happening, but over time it damages your teeth, causes jaw pain, headaches, and even jaw disorders. Stress and teeth misalignment often cause it. Because it happens during sleep, Many people do not realize it for years. Cataphrenia. Cataphrenia is sleep-related groaning. During sleep, a person makes long, moaning sounds while breathing out. It is different from snoring. It usually happens during deep REM sleep and may include holding breath before making a low sound. It is not harmful, but it can sound very strange or scary. Sleep apnea. Sleep apnea is one of the most serious sleep problems. It is not just loud snoring. It is when your breathing stops for 10 seconds or more, sometimes many times in one night. Your brain wakes you up just enough to breathe again, but you do not remember it. Over time, untreated sleep apnea can cause high blood pressure, heart disease, and memory problems. This is not just a small glitch. It can seriously harm your health. Restless leg syndrome, RLS. RLS is when your legs feel uncomfortable when you try to rest. They may feel itchy, tingly, or like something is crawling under your skin. You feel a strong need to move them. Walking helps, but once you lie down again, it comes back. The more tired you are, the worse it gets. It is linked to dopamine problems in the brain. The result is simple. Sleep feels impossible,